As of mid-May, 18 Americans are being monitored for hantavirus after being on a cruise ship that departed Argentina and spent weeks sitting off the coast of Africa. At least 11 cases of the virus have been reported, with 3 confirmed deaths. It is believed that the first patients aboard the ship were a Dutch couple who were on a birdwatching trip and exposed to a species of rat that is known to carry the virus. Experts say hantavirus is different from COVID and that the public should be less concerned. It's not a new disease. The medical community has a better understanding of how it's transmitted and how to control infections. Typically, hantavirus is not spread person to person. People can get the virus through contact with infected rodents or their droppings, except for the Andes strain, which was found to be present in this outbreak. The University of Florida's chief hospital epidemiologist told me that hantavirus cannot transmit as easily like COVID did, so they are not expecting a large number of cases, especially with the current containment measures in place. But the U.S. response to the outbreak has raised some concerns. A Georgetown health policy professor told me that despite the CDC's track record of being at the forefront of viral outbreaks like Ebola and Zika, its response to hantavirus has been disjointed and late. Some policy experts attribute this to some of the Trump administration's actions around public health. At the start of 2025, the Trump administration cut about 10% of the CDC's staff. At the start of 2026, the U.S. officially completed its withdrawal from the World Health Organization. Not to mention, the CDC is currently operating without clear leadership. So while health experts agree that hantavirus is not likely to create pandemic-level concerns, it has raised questions about the United States' ability to handle another disease outbreak, one that is far more transmissible than this one.